this video, I'll talk about male genital care. How to take care of the area, what to avoid, what not to do, what should you do, and when to go see a dermatologist. So, male genitals, the penis and the scrotum area, obviously an area that there's a lot going on over the area. There's a lot of friction as far as just putting on the underwear. Obviously, there is peeing, there is sex, there's other practices that people, believe it or not, busy themselves with just to clean the area or maintain the area, and all these things make that area in particular very, very susceptible or inclined to get irritated and worked up. The interesting thing about genitals generally is that they respond to, first of all, withdrawing the offensive elements, or meaning taking away the irritating factors. They respond actually very quickly to that, and they respond very well to appropriate treatment in many cases, faster than most areas on the body. The reason is the genitals, both male and female genitals, contain a very large concentration of oil glands and other skin glands that can really facilitate or make faster, more effective the healing process that ensues. And they also are naturally rich in moisturizing elements, the glands and so on. So the penis area doesn't really need much care, if you believe it or not. The area needs to be, first of all, left alone, meaning avoid doing anything that is abrasive to the area. So, things that are abrasive to the area, much like any other part of the skin, are hot water above 104 degrees Fahrenheit or 40 degrees centigrade, the piping hot showers. Very, very bad idea for the privates. Also, strong streams of water are another bad idea. They can be physically and thermally irritated to the area. Another thing to avoid, which many people do instinctively, reflexively, if you will, over the area, is soaping, cleansing, and washing. And this is, most of the area does not need that. The one part of the area which may need some very gentle soaping are the groin folds, because groin folds can produce strong body odor. That's not a given, by the way. If that's an issue for you, consider using a very gentle kind of soap over the area. I'll make a recommendation in a moment. However, soaping, cleansing, and washing of the area instinctively or reflexively should not be a thing. You can clean the area, so-called clean the area, with lukewarm water, inflicting very little damage on the skin there and avoiding big trouble down the line. The other thing to avoid, and that is a big absolute no-no, are physical abrasives. That means avoid using any sort of sponges, scrubs, loofahs, exfoliants, brushes, washcloth, gloves, anything and everything physically abrasive over the area. When you actually dry the skin up over the area after showering, use a pad dry approach. Do not rub the area dry. That's going to increase the sensitivity of the area and is going to make the area more sensitive, more irritated. Other things to avoid over the area, which a lot of people tend to do, are reflexive disinfection of the area. Some people tend to use disinfecting wipes or tend to use alcohol or hydrogen peroxide over the area, or it's instinctively, especially, by the way, when there are issues over the area. Believe you me, no matter what the situation is, even if you're dealing with a skin infection over the area, in most cases, the area is not better off by disinfecting. In fact, most disinfection techniques that are available out there and are available over the counter are going to harm the integrity of the skin, making the skin worse off, and perhaps even if you have an infection, making the infection worse. So things need to be addressed specifically over the area. The blowtorch approach does not work over that area or any other area for that matter. Also, avoid using antibacterial or antifungal creams or products over the area, as those can actually cause further irritation on the skin, and especially if you're not treating the right condition, that is a double whammy, waste of product time and obviously digging yourself deeper into the irritation and sensitivity hole. One special note for people who are not circumcised, people who have foreskin over the area: avoid aggressive cleaning of the secretions or the residue underneath the foreskin, as those are specially designed to moisturize the area. Unless there's a very bad odor and a lot of secretion, in which case this might need to be seen by a dermatologist and evaluated for what's happening there. It could be some form of an infection of the area or severe irritation. But under the normal run of things, underneath the foreskin is not an area that needs to be cleaned aggressively. So I want to make that point, because what I usually see in my practice are people coming in who are busying themselves cleaning underneath the foreskin and making the area really sensitive, and in fact making their condition, which is usually irritation of the head of the penis or the foreskin, worse with their cleaning practices. So, what can you do over the area? Well, I just said all these things that I'd rather that you didn't do. In fact, they're very harmful to the skin around the privates. Well, what can you do? Well, first of all, you can use lukewarm water to wash the area. Believe it or not, the area will respond really well to lukewarm water applied gently to the area. No strong streams of water. In most cases, that will actually eliminate body odor of the area. If you're so inclined to do something a little bit more aggressive, you can use a scent and dye-free soap. My favorite product is the Vanicream body wash or the Vanicream bar of soap. These are actually very minimalistic products created with the least amount of ingredients. They're very gentle on the skin, and again, apply them conservatively. Do not go overboard. You can use it on the groin folds, maybe use it on the scrotum if the scrotum is very sweaty, but other than that, avoid using it over the rest of the area. That's not going to give you any benefit. Now, what can you do additionally? In most cases, you don't need to do anything. However, if you are exceptionally sweaty over the area, you can use cornstarch, as in powder grade cornstarch, over the skin folds to soak up that residual moisture. And if that doesn't help, I would actually recommend seeing a dermatologist to address the sweatiness issue. If you have any irritation over the area or sensitive skin, moisturization may be in line, may be appropriate to do. You have to moisturize judiciously, meaning you have to be careful and intentional what areas you're actually moisturizing, and those areas have to be sensitive or dry, in which case the moisturization is appropriate. My favorite moisturizers, white petroleum jelly or my creamy Carnauba moisturizing balm. These are greasy and occlusive moisturizers, so a very small amount is going to be all you need to take care of business. Just a drop size amount or a pinhead size amount applied over the affected areas as many times throughout the day as the area gets dry. However, if the dryness persists over the area, let alone irritation over the area persists, then it's time to see the dermatologist. Dermatologist is going to evaluate what is affecting the area, what condition you're suffering from, sometimes on exam and sometimes requiring additional tests to determine what is happening there. In some cases where you have pimples of the area, that's another reason to go see the dermatologist. And anything and everything that you're not sure about that is affecting the area, that is irritating the area, it's time to see the dermatologist if it's not resolved with just great skincare, avoiding all the abrasives, and taking care of business with moisturization. Now let's address the elephant in the room. Hair removal. Should we do it? Should we not do it? So hair removal is a growing fad in the male community. More and more men are doing it nowadays for God knows what reason. Sometimes it's aesthetics, sometimes it's partner pressure, sometimes it's other reasons. I don't want to go into the full list. It doesn't really matter. It is a growing tendency. It is a growing trend in the general population. So let's address that. So what does hair removal do? Well, hair removal, first of all, is a time spending activity. So obviously you take care of it. Sometimes you do it professionally, sometimes you do it on your own. In any case, it does take up some time and it does take up some money. What is wrong with hair removal? Well, the hair over the area is actually serving a role. In fact, it's serving a number of roles. First of all, it is cushioning the area, and that area in particular, especially when involved in sexual activity, does need that cushioning to sustain some of the friction and other elements of the physical activity. Another thing that hair appears to do is to lower the risk for infection, specifically the risk for warts. And my practice in particular, many of the patients that I've seen that came with multiple warts of the area often had a shaven pubic area. That apparently opens up the area to irritation, and that irritation builds up sensitivity, and in turn that sensitivity can turn into an area that can be an opportunity for infections like warts to take over and affect the area as well. So generally speaking, my recommendation would be not to remove hair from the area. It is obviously a time and money waste, and it can actually open up the door for irritation and even infection in some cases. However, if you must go ahead and do it, my recommendation would be to do it in the least irritating way possible. What does that mean? Well, first of all, use a sharp razor and use some shaving gel when you do it. If you're using other techniques, again, make sure that there's very little drag over the area, there's very little friction involved with the hair removal. Some people opt for laser hair removal or electrolysis. These are both legitimate techniques. They obviously need to be weighed with the right professional and make sure that they're the right treatment options for you. However, these are longer lasting as far as the results are concerned, and they may be the way to go, especially if you are decided on hair removal for that area. Another thing to remember to avoid over the area are baby wipes. I've made a couple of videos about baby wipes and wet naps. As you know, I think that they are very, very bad. They're a horrible product. They contain a number of elements that do not have any business belonging on the skin, specifically preservatives, and in many cases they contain fragrance and other plant extract materials. Those things can actually be severely irritating to the area, and I see a growing number of men that are using baby wipes or wet wipes over the privates, not only over the perianal area, but also over the privates to clean the area up in whatever way possible. That is another source of potential irritation to the area, and obviously a big time and money waster. So don't do it. Clean the area up as we discussed. Don't use baby wipes over the area. Well, thank you so much for watching this video. If you got some benefit from it, please hit the like and subscribe button. Share it with the people you love. More great content coming your way from this channel. Thanks again for watching, and God bless.
Brian Little.